Hey everyone, OT Life Hacker here. What's up? Wow, what's up for me is that I am going to be sharing with you guys lessons learned. Whew, golly. Acute care is hard. I do not doubt that whatsoever. I am eating my lunch right now. That's over here. So it's my lunch break and time to share with you guys on the things I got scolded for because it's already week 11 and I still am making these mistakes. Oh boy. So these are mistakes for you guys to learn so that you don't keep making the mistakes that I do. There's a lot of things that you need to remember in acute care in the hospital. And when you walk into the patient's room, make sure you know all of their precautions. And in order to know the precautions, you'll probably want to know their history with consults, what doctors or what providers had been consulted, and figure out, do they have any procedures? If they had procedures, do they have any weight bearing restrictions, meaning they can't bear weight, put weight onto one side of their body, their hand, their arm, their wrist, their leg. Those are very important because when you're doing therapy, when you're doing your treatment, you have to know, are they able to do this? And if so, for example, grooming, can they use this arm to bear weight on? If they're standing at the sink, can they bear weight on one side of their body? You have to know these things. You cannot just go in without knowing it. And that is not my problem. I'm just gonna share with you what mistakes I had made mixed in with everything you need to know. So basically this is gonna be what you need to know for acute care. Hello. There's some cute dogs walking by. I always get distracted by cuteness. Okay, so you walk into the room, you know their precautions, you know what you can and cannot do with the patient, and then you observe the room. Sometimes what you see in the room is not always what it reads in the chart. You may see that the patient has a knee brace on, but there is no knee brace. So you have to figure out, do they still need the knee brace? It says, technically in the chart it says they do, but you check with the nurse, they don't. So stuff like that. You always have to be cognizant that in acute care, things will always change. Never can you assume things will be the same, even if that's what you read in the chart. And so that's why communication is utterly important. You have to make sure that you are talking with everyone. Okay, so you walk into the room. Is the patient wearing socks? Ding, 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 ding. That was my problem. The patient had their toes covered. I assume, never, ever, ever assume, guys. Assuming leads you into trouble. I assumed that they had socks on, getting them to the edge of the bed, and bam, no socks on. Oh my gosh. Yep. And then my supervisor, of course, walks in during that time. They're like, Jasmine, there's no socks. And I'm like, oh, there's no socks. So you can't stand them up unless they have those no-slip, non-slip socks on for safety, guys, safety. And then when I was trying to get the patient up, I forgot to adjust the walker. Always make sure you adjust the walker. The patient, of course, has to be 6 feet tall, and I have the walker at like a person for 5 feet and 4 inches. And I was like, oh, why? So definitely, because once the patient is up, which the patient was not yet up, I realized that as the patient was sitting up, that the walker was not adjusted to their height, and I thought, oh darn it, I need to adjust the height to them before they even sit up, because if they're sitting up, what if they're not steady? What if they have a loss of balance? You are responsible for the patient. You have to make sure they are safe. This is your liability. So definitely always make sure that you have all the safety checks marked, checked off. And then, as I said, know the precautions, and also before you get the patient up, if they are in the intensive care unit or trauma unit or something that has telemetry, which is the heart and oxygen monitors, always make sure that all the wires are cleared, that they are not going to obstruct the patient when the patient gets up. If you are going to walk the patient, have them walk to the bathroom, to the sink, make sure the wires are cleared so that you can safely get the patient up and you don't have to play with and mess with the wires when the patient is up. In the beginning, I had these problems, and I still sometimes have these problems where I forget about one wire, or I forget about a condom catheter or Foley catheter, which is for their, if a patient needs to urinate, it's already attached to them from the bottom, and so there's a little baggie that collects the urine, and you have to make sure that that is all in the right place where you need it. If you're going to have the patient get up on the side of the bed, make sure it's on that side of the bed. So there's chest tubes and tons of things to be aware of. And I am constantly needing to keep myself in check. This is definitely a good test of my memory and my attention, divided attention, and flexibility, mental flexibility, all of that. So, whew. Well, that is my spiel on all the things that you have to keep track of, guys. And trust me, there's more than that, but these are the keys that I am finding myself running into trouble with, so I always have to keep track of that. Okay, talk to you guys later. Now time to eat my lunch. Oh, bonus for you guys, bonus. Few more things. Keep the bed locked. Always make sure that the bed is locked when you're getting the patient up. If there's a wheelchair, make sure the wheelchair is locked, and watch the vital signs. So for example, I had a patient that had fainted on me today, and so what you need to make sure of is that you are checking their vitals. Are their vitals okay? Their heart rate, their blood pressure, their oxygen, respiratory rate, is all of that good? If you find that it's a little off, check with the patient. Is the patient having symptoms? Say for example, my patient started sweating, and that was a symptom that something might happen, and so be very, very careful. All right, talk to you guys all later. Remember, always safety first for you and the patient, so make sure you have everything in order. You check the precautions before you go in the room. You go in the room, set up the room so that everything is safe when you get the patient up and out of bed. All right, talk to you later. OT Life Hacker out. If you like this video, please subscribe and please like the video. We have 120 subscribers, guys. Woohoo! Okay, so keep up the joy and share the love. If you share what you want to see in the comments below, other things that I can help you guys with my knowledge as a student and helping other students in occupational therapy or even physical therapy, I believe this applies to you guys too. So whatever else I can help you guys with, and if I can, share it below and I will do my best to do so. Talk to you later. Peace out. Bye bye.